Hello, Assalamualaikum and welcome to the channel. Today we are starting the anatomy of human ear. There are two main functions of human ear. It detects and analyzes the sound and converts it into the electromechanical impulses. And second function of the human ear is to maintain the balance. The human ear is anatomically divided into outer ear, middle ear and inner ear. Today's video is about external ear or outer ear, and there will be a separate video for middle ear and a separate one for inner ear. Functionally and structurally, the external ear can be divided into two parts. One is this auricle and second is this external acoustic meatus. This auricle captures sound and directs sound waves toward the external acoustic meatus. The external ear is mostly cartilaginous, but the lobule is not supported by cartilage. The cartilage of the auricle forms an outer curvature known as helix. This is helix. And the inner structure that runs parallel with the helix is called antihelix. You can see this is soft tissue as human ear is seen with naked eye. This is cartilage, just cartilage without soft tissue. And this is how the cartilage is invested into the ear. And lobule is free of cartilage. In the middle of the auricle, there is a depression called concha. Here, this is concha. And concha continues as external acoustic meatus. Concha continues as external acoustic meatus. Posterior to the beginning of external acoustic meatus, there is an elevation called tragus. This is tragus, and this is antitragus. Okay, these were some important landmarks of auricle, and now come to the external acoustic meatus, also called external auditory canal or external auditory meatus. In appearance, the external auditory meatus is slightly curved and ends blindly at the tympanic membrane. This tympanic membrane separates the middle ear and external ear. This is a boundary between middle and external ear. We will learn about the tympanic membrane when we will learn about the middle ear. The canal's length is roughly 1 inch or 2.5 centimeter and is lined with tiny cilia. The movement of that cilia is directed outward, and the skin of the external auditory meatus is also lined with modified sweat glands that produce cerumen. These glands are also called ceruminous gland. Cerumen is earwax. That earwax helps to discourage the insects from entering the ear. Now let's come to the vasculature of the external ear. External ear is supplied by the branches of external carotid artery. This is external carotid artery coming up, and the branches that are given to the ear from the external carotid artery: posterior auricular artery, superficial temporal artery, occipital artery. Deep auricular branch of maxillary artery also supplies the deep aspect of the external acoustic meatus and tympanic membrane only. The sensory innervation of the skin of the auricle comes from numerius nerve. Greater auricular nerve innervates the skin of the auricle lobe area. It is the branch of cervical plexus. Lesser occipital nerve innervates the skin of the auricle somewhat here. It is also the branch of cervical plexus. Auricular temporal nerve innervates the skin of auricle and also the external auditory meatus. And this is the area of the auricular temporal nerve. Auricular branch of the vagus nerve innervates this area. This purple area is auricular temporal nerve. This blue area is lesser occipital nerve. This green area is greater auricular nerve. And this pink area is auricular branch of the vagus nerve. This lesser occipital and greater auricular nerve are the branches of cervical plexus. Auricular temporal nerve is branch of mandibular nerve, and the auricular branch of the vagus nerve innervates the skin around the concha. This was all about the external ear. Khuda Hafiz till we meet in the next video.